Welcome to our series, Moving America Forward. Each week we'll be focusing on America's entrepreneurs as they take us to new roads, new opportunities, new ways to fill the gaps left by today's failing companies. Our series will be looking at that and a lot more. So come with me and watch as the entrepreneurs of our nation move into the future.
And I'm Doug Llewellyn here in our studios in Los Angeles with our guest today, who is the founder and the director of 21st Century Pain Institute, headquartered in Newport Beach, California. I think you're going to find this absolutely fascinating. I'd like you to meet him now, Dr. Phillip Yoo, who points out that the future of non-surgical, non-invasive pain medicine is finally here. Doctor, welcome. It's a pleasure to have you with us.
Hey, Doug, thank you for having me.
You know, pain management is something that's so critical in society today. I know people will be glued to this. But before we get into it, I want to point out, a short while ago, you had a chance to answer some questions from William Shatner. Let's take a look at a brief portion of that right now and see how it went. Okay?
Okay.
All right, let's watch.
Good to have you here. I'm very concerned about health care. The real issue is, how do we keep Americans healthy? And I understand that is one of your goals. So tell me, what are you doing to help us stay healthy? Any new procedures and developments that help people to live more productive lives and in so doing move America forward?
Well, Mr. Shatner, the non-invasive, non-intrusive medical devices once seen in Star Trek have now become a reality. We have developed new techniques and procedures using LED and infrared light technology, Class 4 lasers, and pulsed electromagnetic field waves that are having a dramatic impact on those suffering from chronic pain. For the first time in a long time, these people are actually able to go out in the world and enjoy life again, pain-free. And that, Mr. Shatner, is how we are helping to move America forward.
That was really interesting what you had to say to William Shatner. I want to point out before we get involved heavily in this that Dr. Yoo is he's a best-selling author, as we will show you. He was the official chiropractor for the 2008 Beijing Games. He was a chiropractor at the CrossFit Games in 2010, 2011, 2013. He was also the backstage chiropractor for the Beyonce tour. He knows all about what went on there, and he is nicknamed the Pain Terminator. It's a pleasure to have you here. This is interesting. You know, I find it fascinating that the tools of your trade, really, of science fiction, are now a reality, aren't they?
Yeah, Doug. Yeah, they sure
I mean,
are.
here's a classic example, folks. Take a look at this. I don't even know what it is. It's a laser of some sort. Explain to me what you do with this tool.
Well, if you've ever seen Star Trek, the TV show, or the movies, you know, Dr. Bones McCoy always had this device called the Qualcomm tricorder, and he'd just wave it over the patient and it would give him the diagnosis without any invasiveness. And this pretty much does the same thing. For instance, let's take bone-on-bone osteoarthritis of the knee. Now, arthritis in Latin, itis is inflammation,
right.
You know, pain, swelling, heat causing the pain. Well, we can detect with this infrared thermometer, which this aiming laser beam will detect exactly where the arthritis is worst on the bone-on-bone knee arthritis, and will tell us exactly where to treat it. Now, this is only a diagnostic tool. The way we treat that knee is, this is the world's most powerful German diode Class 4 laser at 60 watts, and what this does is...
You need your glasses for this?
Oh yeah, you need the protective glasses.
That's
you better
exactly
put
right.
that on.
You've been cautioned about
now
this.
you
Okay.
look like one of the members of the USS Enterprise.
Okay.
And then what the laser does, it increases blood flow and circulation to the knee, because the knee is an avascular structure, which means it has a poor blood supply, which delivers oxygen, nutrients, glucose, so the knee could actually heal itself. And the invisible photonic energy actually stimulates stem cells. And what we feel, now this was proven in a study on rats, can regenerate the cartilage in bone-on-bone knees.
But tell me a little bit about your background and how you got into this. I mean, pain management is such a critical issue in society these days. So many people suffer from it. Oh, how'd you get into this?
Well, basically what happened was I got into that exercise program called CrossFit, which is very vigorous. It's a combination of like gymnastics, Olympic lifting, you know, running, triathlons. And I had hurt my back, and then I got severe sciatic pain, and nothing helped. I tried chiropractic, physical therapy, decompression, acupuncture. I did not want to do any drugs or surgery. So I actually went on a world trek to find out how I can cure my sciatica, because I couldn't even drive a car for 1.5 hours with the lightning pain shooting down my leg. So finally, out of all my travels, I found this high-powered German diode laser, and within a dozen treatments, it knocked out the sciatic pain in my leg, and I said, this is something I want to offer to my patients. So thus was born our 21st Medicine Institute.
And where did you find this? I mean, whereabouts?
Well,
were you in Europe or somewhere else? Or
well,
here?
I had traveled to, when I was hired to work at the Beijing Olympic Games, there was another sports doctor who had a smaller type laser, and he was treating Dick Fosbury's elbow. He's a retired gold medalist in the Fosbury flop, right, the high jump.
Right.
And it helped Dick's elbow, and I'm like, if this little laser could help him, I got to find a big enough laser to treat my back, and sciatica, it's a bigger body part. So this other doctor from Utah had a similar laser. I flew up there, and a dozen treatments, and knocked out my pain. So, yeah.
So you now have the 21st Century Pain Institute, which is headquartered in Newport Beach. I know you have an office near Disneyland. You have one in the desert in Rancho Mirage. You're soon to have one in Beverly Hills, and you're opening up one in Mexico. Yes. I mean, you're really spreading out. Who are the typical kind of clients that come to you?
Our typical client are mostly baby boomers and seniors who think they're 20 years younger, but they don't want to give up the sport or activity or travel or even hikes, or even just walking the dog or taking the grandkids to Disneyland and not be limited just because of age. And these folks have tried, you know, pain pills, they've tried injections, even some surgeries, and they're still suffering from ridiculous pain. And those are the type of patients that we can help. So we are really the last resort before or even after failed surgeries.
Now, you demonstrated how you can use the laser on the knee joint, for example. How long does it take you to realize some benefit from utilizing the laser?
This laser is so powerful that within usually 6 sessions, we could eliminate most pain or at least get partial relief.
Define for me what causes that pain. Is it bone on bone that's causing the pain?
Well, if we talk about degenerative arthritis of the spine, which yes, you lose the disc space, or the knee, or any type of joint like the hip, yes, when the body, it literally wears out the cartilage, so there's no cushioning left.
Right.
So the bones rub together, and when you rub two objects together, it creates friction, which creates heat, swelling. That's what inflammation is. But with the high-powered laser, we're delivering nutrients to that joint, and what that's going to bring in blood flow, stimulate stem cells to go in there to regenerate the cartilage.
It regrows, helps regrow the cartilage.
There was a study done on rats with bone-on-bone arthritis of the knees, and after 30 laser treatments, they were able to regrow the meniscus, which is the cartilage in the knee joint. Now what I'm doing, I'm heading a study to prove that in humans as well.
Do you find you're fairly, I mean, again, you hear so much about pain and people who can't get rid of pain. Do you find you have pretty good success?
I would say, even though we're treating the people who've been to every pain specialist, neurologist, orthopedic surgeon, acupuncture, chiropractor in the country, and those techniques have not worked. Despite that, the majority of our folks, they either get partial or complete remission of their chronic pains.
You know, we have one of your patients on the phone who has agreed to call in and talk to us. So she's on the line right now. Her name is Margaret. Margaret, can you tell me, Margaret, can you hear us?
Yes.
Good. It's nice to have you with us. Doctor, you tell me a little bit about Margaret's, in short, tell me a little bit about what her case was.
Margaret's husband, which became a very good friend, and he was the chief general surgeon at the Veterans Memorial Hospital in Long Beach for 35 years. He's trained over 457 doctors how to operate, so he knows about mobility. Well, Margaret had lost mobility and cartilage in her knee. She already had a knee replacement in her right knee, but she did not want to go through that again for her left. So Dr. Jeweler brought his wife in, And I think after the second or third treatment, within 6, she was able to get out of the chair and walk out with 60% less pain.
Let me get her to tell. Margaret, tell us about your experience with Dr. Yoo.
Well, I found him to be an honest and straightforward person, and he offers such a rare service to us. And
tell me how he helped you. Tell me how he helped you.
Well, I had bone on bone, and I couldn't sleep through the night, and constant pain. So he is a brilliant person, and he has really come through with what he claimed he could do.
Are you better now?
Oh, yes, sir.
It was well worth doing, right?
Oh, I should say so.
Listen, thank you so much. That's an example,
Well,
exactly what you were talking about.
she's 90 years old.
90?
Bone on bone arthritis, and there's no space left in her knee joint.
Yeah.
And if she could walk out with 60% less pain after one treatment, I mean, that's a testimony in itself. So,
you know, there's so much I could talk to you. It's just such an amazing story. I want to point out, everybody sees these. These are tools that you've developed. Tools of the trade, so to speak, right? And one other thing, put on those glasses for me. Tell me the fancy glass. This is really Star Trek here.
Well,
tell me what this does.
These are our LED blue light phototherapy glasses. I'll turn it on. And this is called neurofeedback light therapy. So basically what the lights do, they stimulate the areas of your brain so you can get normal brain waves. There's 4 waves in the brain, alpha, delta, beta, theta. And when your brain waves are too hyper, you get anxiety. It stimulates your sympathetic nervous system so you can't sleep. Some people get tinnitus, ringing in the ears. So your senses are heightened. They can't calm down. But we could program at this with different hertz. So for anxiety, it would be like 1 or 2 hertz. And for people with insomnia, that would calm your brain waves down. Now, people with slow brain function, memory loss, Parkinson's, Alzheimer's, we can speed up the LED lights to get you into a normal brain function.
You know, this is another tool of your trade. Explain to me what I'm holding here.
Well, inside those round coils is a solenoid made of copper, because this is pulsed electromagnetic field therapy. And right here I can control the intensity of the magnetic field. You hear that?
I can hear it, yes.
Yeah. So what this does is, I'm going to put it on your hand. Let's say you had carpal tunnel syndrome.
Right.
You feel it on your wrist right there?
I definitely do, yeah.
What it's doing, it's putting in waves of pulsed electromagnetic ions to stimulate blood flow. Now, this has been FDA approved for post-surgical pain and swelling, depression, because we could do transcranial magnetic therapy on the brain, and healing bone fractures.
So why would it be like this? Is this to put it over somebody's head?
We could put it, if we treated your head, we would put it under the frontal lobe right here.
Right.
All right. And then if we treated like your wrist, you'd put your wrist inside. If you had peripheral neuropathy, numbness of the feet, we'd put the foot right in here. And we can treat, if we did the knees, we would surround both sides of the knees like this. So it's a very versatile tool. And again, it's non-invasive. And it's a perfect complement with the laser, because this also stimulates stem cells. How do you think it regrows bone? Stimulates the osteoblast.
You know, you just mentioned the key thing. You said it's non-invasive. Everything you have here is non-invasive.
Well, exactly. So, yeah.
And it all works. This is 21st century medicine.
Yes, it is. Yeah. We are in the sick bay at the USS Enterprise, so as far as I'm concerned.
That's amazing.
And then we also have these space-age tools, which I've designed with an aerospace engineer. And this is our carpal tunnel tool.
Yeah.
Instead of carpal tunnel surgery, we would release the carpal fascia, the tightness and scar tissue in those bands of adhesions. We'd break it up. You feel that grinding in there?
Yeah, yeah.
And again, this is like doing surgery, but from the surface. And then we would do some pulse electromagnetic field therapy, and we would top it off with the laser to stimulate blood flow, and that's going to rebuild the tissue that we've just broke down. So, yeah, that's how it works.
Yeah. I'm feeling great.
Yeah.
Doctor, this has been an amazing experiment and display. Thank you so very much.
Thanks, Dub. Thanks for having me.
You're welcome.
Yeah.
This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation that it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present this prestigious award to Dr. Phillip Yoo, the president of 21st Century Pain Institute of Newport Beach, California, for the outstanding work that he is doing to help keep moving America forward. Dr. Yoo, congratulations.
Thank you, Doug. It's been a real honor on behalf of my staff and my patients. Thank you.
You're welcome.
That's it for another edition of Moving America Forward. I'm Bert Tenzer. Join us again as we continue to bring you the entrepreneurs who move America forward.
I'm William Shatner, and for all of us at Moving America Forward, thanks for watching.